time. Well, it is a pleasure to present to you some updates on COVID. And I know some of you may have a lot of questions. I'm going to try to go through this um, as efficiently as I can. And then at the end of it, please take notes or take mental notes so we can entertain the questions. So we're going to talk about pandemic facts, epidemiology of COVID-19, how to navigate the upcoming holidays and family gathering in the era of COVID-19. And can you all see the PowerPoint slides?
Yes.
Thank you. And then updates on COVID-19 signs and symptoms, testing sites and vaccines, treatment and vaccines. So pretty busy. Uh, the, the facts are COVID-19 is here to stay for a while, even with a relatively effective vaccine. Whether you're a believer or not, whether you are a Trump supporter or not, COVID-19 is here to stay. It is impossible to live exactly like we were living pre-COVID, attending academic meetings, social meetings, and religious activities the same way that we used to do. We need to get that into our head. The patients need to get that into their head. The community need to get that in their head that we cannot live the same way we used to live. So we have to learn to live with COVID. On one hand, we cannot live the same way, but at the same time, we need to learn to live with COVID-19, okay? So there needs to be public health measures like hand washing, social distancing, and face covering. Those, even with a vaccine, they will be complementary. So you will never really have or just vaccine. Why? Because number one, it's very difficult to make good vaccine for viral infection, for viruses. And it's going to be a challenge even with the coronavirus vaccine. They're talking about 50%, 60% effective. So we will still need the hand washing, the social distancing, and the face covering. And keep in mind that you are not too young to get COVID-19 and suffer from the complication of COVID-19. Now we're talking about 20-year-old, 25-year-old that are actually dying from COVID-19. Not too many of them, but some of them actually have died of COVID-19. And COVID-19 does not respect any socioeconomic status and really religious affiliation, whether you are Mormon, you are Jehovah's Witness, you are a Baptist, you are Church of God, Pentecostal. We all get affected. Catholic, we all get affected. So keep that in mind. Lockdown and quarantine, this is not the first time that happened. That happens way back in the biblical time in Isaiah 26 verse 20. It says, my people, go into your room and shut your doors behind you. Hide in your room for a short time until God's anger is finished. So talking about quarantine and lockdown, that's been going on for a long time. And the reason why I mentioned that, people are talking about, oh, it is a conspiracy. They actually make that virus so that they can destroy a certain group of people, old people or minority people. We have pandemic every so often. And we had SARS, MERS, that didn't really, I mean, they were like quasi-pandemic, but not as much as SARS-CoV-2 now. And you also had the Spanish flu back in 1918 that actually lasted about 2 years. So this is not the first time. So don't let people fool you or scare you in terms of conspiracies. Now, where are we now with the COVID-19? Worldwide, we have about 50 million cases and with over 1 million deaths. And we are leading in the US with 11 million cases and close to 243,000 deaths. And second country to lead, India, followed by Brazil, Russia, France, Spain, Argentina, United Kingdom, Colombia, Mexico, and so on and so forth. So COVID-19 is still going on. And in terms of the states that are more active right now, uh, you have Texas, top of the line, over a million, California, with almost a million cases and about 18,000 deaths. Florida with almost a million cases and over 17,000 deaths. And then New York, Illinois, Georgia, North Carolina, Tennessee, Wisconsin, New Jersey, Arizona. Those are the states with the most COVID cases. And of course, in Florida, the cities or the counties that are more active are Miami, of course, with close to 200,000 cases and close to 4,000 deaths, followed by Howard, Palm Beach, Hillsborough, Orange County, where we live, with close to 50,000 cases and close to 600 deaths. Now, if you ask yourself, what's going on with COVID-19 right now? Well, it's not looking good at all. It's actually going up. And if you look at this chart, starting from March, how things were down, not all the way down, but they were down. And then now, all the way up now to over, like we said earlier, close to 900,000 cases in Florida. So it is really amazing how things have gotten out of control. And we're not gonna pass blame. We're not gonna live in the past. We have to move forward, and we all have to live together with this, and we have to help each other out. And for daily new cases in Florida, and as you can see here, it's over 5,000 daily new cases going on. So things are hot right now. And deaths, as far as death, as we said earlier, about 17,000, over 17,000 deaths in Florida. Daily deaths, about 52. You may say, oh, no big deal. Well, if it's your family member, your friend, it is a big deal to have daily death. Let's say 52 people die in your family or a part of your friends. That is a big deal for us. In Haiti, right now, we don't know how accurate that is, but there are about 9,000 cases and over 200 deaths. So that's the stat for Haiti. Now, what I really wanted to talk about is, how do you live with COVID during the holidays? Thanksgiving. Should you have Thanksgiving dinner? Should you have Christmas dinner or parties? What about the people with the chronic condition? What about the college student? If you have children who are in college, well, the recommendation though, it is not encouraged to have Thanksgiving party and Christmas parties, the holiday parties. However, you can have them. Well, let me say, you can have get together with people that you live in the house every day. Let's say your cousin has been quarantined or has been wearing his mask, her mask, let's say 10 days before they come to you, or 14 days before they come to you, then they can come over. How are you going to guarantee that? I don't know. Maybe you can require a COVID test before they come, a PCR test before they come. That's a thought. But if you have a family member with health condition, that means asthma, obesity, BMI greater than 30, if you have somebody with diabetes, hypertension, congestive heart failure, kidney disease, sickle cell, you have to be very careful whether to have those get together, because if they contract COVID, things can be really ugly. So what's the recommendation? If you live with a family member every day and you go out wearing your mask, but same members of the family, you can have get together with them. But for other family member, friends that you don't live in the same place, you may require COVID testing. It's not guaranteed that they're gonna do it. Or if they've been quarantining themselves for 10, 14 days before they come over, That may be a possibility, okay? But it is a risk that we are taking because every time you have a group of more than 10 people, COVID may be in the midst of them. Even when you go to church, um, that's a chance you're taking. But when you go to church, you have your mask on and also you social distance 6 feet, but you have to be very disciplined, very strict about it, because a lot of time people violate those boundaries, especially after church. You go and hug people and so on and so forth. Those can be violated. And don't be fooled now. Just because you have masks, that doesn't mean that social distancing is not important. That's very important. So it is uh, important to understand the fundamental for prevention of acquisition of transmission of SARS-CoV-2. So that's why you have to um, obey the rules of universal wearing of masks and cloth face covering, maintain physical distance, 6 feet or 2 meters, avoid crowds, and we just talked about that. In congregate settings such as bars and parties and church activities. Again, I'm not saying not to go to church because I've been going every Sunday, almost every Sunday, but you have to wear your mask and you have to make sure you social distance yourself 6 feet or greater. And then remember that outdoors activities are better than indoor activities. And you have to frequently wash your hands or use the hand sanitizer. Washing with soap and water is actually better. Again, wear your mask, stay 6 feet apart, and wash your hands. Very important. Now, the truth about masks is that masks work. I know there's a lot of conspiracy. People say you will get sick, but according to studies, mask wearing actually it works. For example, if you are a COVID-19 carrier without a mask and you have COVID-19 and you don't have any symptom, okay? You're walking around, no mask, no symptoms. You can actually give it to your friend or your family 70% of the time. And and and, and even if the person is wearing mask, as you can see here. Okay. Now, if you're a COVID carrier and but you wear a mask this time, so you may not have symptoms, but you wear your mask. The other person may not wear a mask. You can still transmit it, but 5%. So mask is important. You still need the social distancing because even when you wear the mask, there's still a chance of transmitting the disease, but the chance of transmitting is much less when you wear the mask. Okay. But now, the last case, if both of you wear a mask, I have COVID. Let's say I have COVID. I'm carrying COVID, but I don't have any symptom, but I wear a mask, and you don't have anything. You wear a mask. We both wear a mask. You can still transmit it, but it's much less at 1.5%. So mask wearing work. Don't let people fool you to tell you that it doesn't work. It works. I'm hoping that 100% of people will wear masks, but that's not the case right now. But I'm really happy that quite a few people are wearing it. Actually, what I see on the street, what I see in the clinics, and so on and so forth, people are actually wearing their masks. But some people they refuse. They have all kind of excuses. They can breathe, or they have this, they have that. But you know what? I can't breathe either. When I wear my N95, I can barely breathe. I mean, I'm stuffy, but this is a sacrifice that I have to make for my family, for my friends, and so on and so forth. We all have to sacrifice right now. And please, when you get your mask, do not choose masks that are made of fabric or that makes it hard to breathe. The mask with the valve, because virus can actually escape there. And the N95, leave them for the providers, okay? And then when you choose your mask, you have to choose masks that have 2 or more layers. And remember, the masks that are made of cloth, the cotton mask, the double cloth mask are actually better if you're gonna use those. of course, your surgical mask and then your N95. But for home use, you can use double cloth mask with cotton. Remember that they should be done or made with cotton. Okay. And the gator mask, be careful with them. People who wear only face shield, it's not guaranteed that you're not gonna get COVID because you still need that protection. You need to wear your mask and the face shield if you're gonna do the face shield. And of course, children, it's hard for them to wear masks if they're below 2 years old, but you will be surprised. Some of them actually, they do well, even below two. And guess what? You are the example. As long as they see good example, good leaders, mom and dad wearing their mask all the time and tell them why they wear the mask, they will follow suit. Keep that in mind. How not to wear your mask. Some people think that mask wearing is fashion. Some of them wear it around their neck. That's a no-no. On your forehead, that's a no-no. Under your nose, nope. On your nose only, nope. Some people do it on their chin. That's a no-no. Dangling from one ear, be careful with that. On your arm, that's a no-no. You cannot do any of those. Now, uh, COVID-19 has been killing a lot of people, especially a community of color, especially black people. Black people are actually dying 2.4 times the rate of white people. According to this research, the COVID tracking project, back in September, you can see here, we will say I think per 100,000 people, look at that. Black or African American, 94 per 100,000. Hispanic Latino, 61 per 100,000. American Indian, 60 per 100,000. Asian, 43 per 100,000. Whites, 40 per 100,000. Hawaiian, 39 per 100,000. So a lot of people are dying from COVID-19, especially minorities, namely Black or African Americans. So be very, very careful. And where those COVID-19 cases come from? Well, shopping. People who go shopping, they get it. They get COVID-19. People who gather at a restaurant, they get it. Office setting, they can get it too. In the salon, in the home, in the gym. And the gym it's really relatively easy to get it because a lot of time you're exercising, you don't want to wear your mask, you will get it there. Public transportation, in the bars and coffee shops, church, religious activities, people get it. Speaking of church and religious activities, I'm not sure if you are aware of this study that was done. One member who had COVID-19, that was a choir, and one member of the choir had COVID-19 and successfully transmitted COVID-19 to most people in that choir. As you can see, everybody in yellow, uh, they were all victims of COVID-19. And even the people in white, as you can see here, 2, 4, 6, 8, there was probability that they also had it too. So be very careful. This coronavirus, SARS-CoV-2, is very, very contagious. As you can see, one person out of the choir contaminated everybody in the choir. And one of the reasons for that is as you're talking, you have a lot of airborne well, it becomes airborne basically. And the more you talk, the more you shout, the more you are praising the Lord without mask on, the more you're gonna the particle is gonna travel. Remember that. Even though they say in 6 feet, it's mostly droplet borne, but it can become airborne when people are shouting or doing procedures like intubating somebody and so on and so forth. Now, this is a picture at one of the churches. As you can see here, there was a big event, and you can see here, most of these people I know because I was at my church, by the way. And you can see some people had masks, they did well, but some people, did not have masks. And what do you call this? This is called a super spreading event. So that's a no-no. As I just showed earlier, that mask works, and if you don't wear it, you can expose other people. So please be very careful. That shouldn't happen at this time. How to take off your mask? You have your mask on, and then you look, catch it or take it by the strength, and then you get it out. You fold the outside corners together. You throw it away, and you wash your hands. How to clean your mask? Basically, warm water. You put it in the washer, just like you put your clothes in, warm water, and then you dry it after that. Masks that are good and masks that are bad. So green is good. So surgical mask, number 4, you can see is good. Number 7, number 10, number 13 is good. The one on top here is no good. It looks pretty, but it's not good. Number 5 is good. Number 8, good. Number 14 is good, N95. Number 6 is good. Number 9 is good. So those are good masks or decent masks. But when you have your patients come in the office with bandana or handkerchief, please let them know they're not protecting themselves. Okay. Again, science says that wearing masks and social distancing slow COVID-19. Scientific evidence is clear. Social distancing, wearing masks actually help people prevent people from spreading the COVID-19. Very important. Now, how to select your mask, we just talked about that, but it's not just a mask, but you also have to do social distancing. And the truth is that masks work and they're very important. Everyone should wear one. People who say, I don't believe masks work, are ignoring scientific evidence, and it is selfish attitude as far as I'm concerned. So we all need to do our part and to stop the spread of COVID-19. I mean, there are a lot of worries about COVID-19 going up, but it has to do with people behavior because the mask, it works. The social distancing works. I mean, maybe not 100%, but it works if they're doing it appropriately. A little bit about the symptoms of COVID-19. The bottom line is, please don't get that disease. It's an awful disease from what I'm hearing. Once you get COVID-19, you may have fatigue, and that fatigue, it may linger even after COVID. About 60% of those patients, they still fatigue. They feel foggy. They cannot think straight. Some people actually retire early because they couldn't function in their role because they contacted COVID-19. The shortness of breath may linger. The cough may linger. The muscle aches. The lack of appetite, lack of smell. You may not enjoy your food anymore. So it is an awful disease. Try as much as you can not to get it, and basically try to prevent it as much as you can and share that with your patients and your friends. Now, in terms of where to get tested, in case you've been exposed or you want to send your patients to a testing center, Barnett Park. Barnett Park on 4801 West Colonial. You can go there Monday through Friday. That begins on November 9th. Community Health Center, drive-through on Mercy Drive. You can go there, 840 Mercy Drive, phone number 407-905-8827. Community Health Centers in Apopka, phone number 407-905-8827. You can go there to get tested. Convention Center on 5980 Destination Parkway. You can get tested there, but you have to stay in your car. True Health, there's True Health Southside on Lake Eleanor. There's True Health on Alafaya. Phone number is 407-322-8645. They will see you there. They will test you. And if you live in Kissimmee area, you can go there, 3010 Main Gate in Kissimmee. Site is open 7 days a week, 8 to 5 p.m. You'll get tested there. Now, we almost done, but let's talk a little bit about therapeutic for COVID-19. We have more um, COVID-19 therapeutics now, and we have remdesivir, we have dexamethasone. Dexamethasone usually for very sick patient. Even though our president, well, our ex-president now almost, received everything, remdesivir, dexamethasone, um, but those are some of the medications that actually have been proven to work, and they're doing studies on some other medication. We have monoclonal antibodies as well, and the convalescent plasma, it didn't pan out quite well. There was a big deal about it earlier, and they're still doing some research, but it's been proven not as effective. But monoclonal antibodies are doing so far looking good. And there's also immune modulators, patients that are very sick. And when you check the IL-6 level, and depending on the level, you can use immune modulators, okay? And then there are also anticoagulants, such as Eliquis for patients that are very sick. They can develop pulmonary embolism. Those patients need to be on anticoagulants. And finally, vaccines. Right now, we are on phase 3 vaccines, and we have quite a few companies. There's different type of vaccine. There's the nucleic acid type of vaccine with Moderna, BioNTech, phase 3 trial. And there's the viral vector where they use adenovirus with by the way, this is the type of virus that vaccine that they have in Russia, from what I understand. And right now we have our own here with Oxford, AstraZeneca, Janssen, Merck. Those companies, I believe they are on phase 3 trial right now. And there's the protein subunit type of vaccine with Novavax and Sanofi. And by the way, I know this is not an economic webinar, but it's probably time to invest as well in those companies. They may be doing well. So those are the companies: Moderna, BioNTech, Oxford, AstraZeneca, Janssen, Johnson & Johnson, Merck, Novavax, Sanofi. Most of them are in the phase 3. Phase 3 trial mean where they studying safety of the vaccine. And if you were to ask me, am I gonna take it? By the way, healthcare provider will be the priority. As far as the safety, if it's safe, I will take it. And this is not the first time we're having vaccines. I mean, a lot of diseases we've been able to get rid of, like the polio, measles, except those that are not vaccinated. So let's pray that they are proven to be safe. And that will definitely reduce the cases of COVID-19. I want to finish with this statement here. Toujours songer, laver menou, mettez cache-nez, yon di lot, coronavirus pas un jouet. It's not a game. So remember. Or remember too that wearing a mask is better than wearing a ventilator. Staying in your home is better than staying in the ICU. And then praying is actually better than complaining. I know there's a lot of complaining going on right now. All right, this is it. If you want to reach me, please visit my website, cadets.solutions. You can go to my Facebook, Instagram, and remember to subscribe to my YouTube channel for more educational videos on COVID-19 and other educational videos. And this is the company's name. You can check it out. And this is it. Any questions or comments?
Oh, thank you. Thank you very much.
Oh, you're welcome. You're welcome. I hope you enjoy this, and please share it with your loved ones, your friends, and your patients. Very important.
Yeah, very educational. Appreciate it.
Great presentation, doctor. Great presentation.
Thank you. Thank you. Remember to share.
All right, so the meeting is adjourned.